My name is Ramona Nedeva. I'm a third-year student at the English Medical Program of Medical University at Varna. I'm a Bulgarian who was born and raised in Chicago, Illinois, and have always wanted to study medicine due to its intriguing complexity and how every disease is similar but different based on the patients. I've spent my whole life translating Bulgarian to English and vice versa. One of my passions is teaching my colleagues about Bulgarian traditions, culture, and history. Charita is 21 from Manchester, England. The reason why she decided to choose medicine was because she loved the problem-solving aspect, making diagnosing patients extremely interesting to her. Her favorite memories of studying in Varna are going to the beach during the summer with her friends to celebrate the ending of exam session. Today, the topic will be breast cancer and how it opens the door to a broader conversation in women's health, equity, and prevention care.
Hello, my name is Charita Musunori and my presentation is on the alimentary prophylaxis of breast cancer. So, introduction to breast cancer. Breast cancer is the most malignant condition of the breast, and it is the second leading cause of cancer deaths in women. Breast cancer can also occur in men, but it is far less common. And about 42,000 women and around 500 men in the US die each year from breast cancer. So the population perspective. Most breast cancers are found in women who are around 50 years or older. Breast cancer can also occur in men. White women are more likely to develop breast cancer than Black and Asian women. So Caucasians and Afro-racist comparison. According to the graph, we can tell that white women are slightly more likely to develop breast cancer than Black and Asian women. However, Black women are more likely to develop more aggressive and more advanced stage of breast cancer, which is diagnosed at a younger age in comparison. And Black women are more likely to die from breast cancer. So, incidence rates on a global level. So, in the corner we can see that there is a graph which suggests that there is the age standardized world rate of breast cancer per 100,000 people. So incidence rates are elevated in Australia, Europe, and North America, notably in Belgium, where there are around 113 cases per 100,000 female population. In Luxembourg, where there are 109 cases per 100,000 female population, and in Australia there are 94 cases per 100,000 female population. There are around 2.3 million diagnosed with breast cancer and 685,000 deaths globally recorded in 2020. So mortality rate. So we have a figure which suggests the mortality rate in women with breast cancer by age group in the US between 2014 and 2018. Breast cancer is the second most common cause of cancer deaths among women, around 15%. So each year, around 48,000 women die of breast cancer, making it the leading cause of cancer deaths amongst American women after lung cancer. The lifetime risk of dying of breast cancer is approximately 3.4%. So statistics of breast cancer in India. The rate of breast cancer in India is increasing. So breast cancer is seen 14% of other types of cancers in Indian women. The breast cancer statistics in 2018 says that the newly registered cases are 162,468 and 87,090 deaths. A woman is diagnosed with breast cancer in India every 4 minutes. The post-cancer survival rate is 60% in Indian women. So global pressure on breast cancer in 2020. So the graph suggests the estimated age standardized incidence and mortality rates in 2020 worldwide for both sexes and for all ages. So in 2020, there were 2.3 million women diagnosed with breast cancer and 685,000 deaths globally. And as of the end of 2020, there are around 7.8 million women who are alive who are diagnosed with breast cancer in the past 5 years, which makes it the most world prevalent cancer. So the World Health Organization's response towards breast cancer. The object of the World Health Organization Global Breast Cancer Initiative, the GBCI, is to reduce global breast cancer mortality by 2.5% per year, which thereby averts 2.5 million breast cancer deaths globally between 2020 and 2040. The three pillars towards achieving these objectives are health promotion for early detection, timely diagnosis, and comprehensive breast cancer management. So risk factors for breast cancer: genetic mutations such as family history and genetic factors, hormonal factors such as age, menstrual histories, childbearing and hormone replacement therapy, lifestyle factors: obesity, alcohol consumption, physical inactivity and diet, environmental factors such as radiation exposure and chemical exposure. So personal health history, so previous breast conditions and other types of cancers, and ethnicity and geographical factors such as ethnicity and geographical location. So the prevention of breast cancer. So to be able to prevent breast cancer, you need to maintain a healthy weight, regular physical activity, balanced diet, limit alcohol, avoid tobacco, regular screening, discuss hormone therapy, genetic counselling, breastfeeding, and limited exposure to toxins. So the diagnosis of breast cancer. To be able to diagnose breast cancer, you can use a mammography, breast ultrasound, breast MRI, biopsy, so the fine needle aspiration, core needle biopsy or surgical biopsy, clinical breast exam, genetic testing, then treatment of breast cancer. So surgery can be used such as lumpectomy and mastectomy, radiation therapy, chemotherapy, hormone therapy, targeted therapy, immunotherapy, clinical trials, and these are my references. Thank you.